My name is Aarti Bede, nursing tutor, Index Nursing College, Indore. My topic is renal calculi. Introduction. Kidney stones, also called renal calculi, nephro nephrolysis of urolysis, are hard deposits made of minerals and salts that form inside your kidneys. Diet, exercise, body weight, some medical condition, and certain supplementation and medication are among the many causes of kidney stone. Definition. Renal calculi are the common causes of blood in the urine, hematuria, and pain in the abdomen. Frank are growing the occur in 1 in 11 people at some time in their lifetimes, with men affected 2 in or women. Uh, Stone, bladder, urethra, stones, and kidney. Types. Uh, Calcium stones. Most kidney stones are calcium stones, usually in the form of the calcium oxalate. Oxalate is the substance made daily by your liver as extra from your diet. Certain fruits and vegetables, as well as nuts and chocolates, have high oxalate content. Dietary factors: high dose of vitamin D, intestinal bypass surgery, and several metabolism disorder, and increase the concentration of calcium of oxalate in urine. Calcium stones may also occur in the form of the calcium phosphate. This type of the stone is more common in metabolic condition such as renal tubal acidosis. It may also be associated with certain medication used to treat migraine or seizures, such as topi, topiramate, top, topamax, trocanate, XR, kidney. Structure stone. Structure stone form in the response to urinary tract infection. This stone can grow quickly and become quite large, sometimes with 5 times or little warming. Urine acid. Uric acid stone. Uric acid stones can form in people who lost too much fluid because of chronic diarrhea or malabsorption. This who eat a high protein diet, and this with diabetes or mellitus syndrome. Certain genetic factors all may increase your risk of uric acid stone. Cystine stone. Cyst stone. This stone form in people with a hereditary disorder called Crestoniya that causes that kidney to secrete too much of a specific amino acid. Causes. Family of personal history. If someone if in your family has had kidney stones, uh, you are more likely to develop stones too. If you we already had one or more kidney stones, you are at increased risk of developing another. Dehydration. Dehydration, not drinking not water each day, can increase uh, your risk of kidney stone. People who live in warm, dry climates and This sweet lot may be a higher risk than others. Certain diets. Eating a diet that high in protein, sodium, salt, and sugar may increase your risk of the some types of the kidney stones. This is especially true with a high sodium diet. Too much salt in your diet increase that amount of calcium. Your kidney must filter and significantly increase your risk of the kidney stone. Obesity, high body mass index (BMI), large waist size and weight gain have been linked to an increased risk of kidney stone. Digestive disease and surgery. Gastric bypass surgery, inflammation, bowel disease, and digestion disease and surgery. Gastric bypass surgery, inflammation, bowel disease, or chronic diarrhea can causes changes in the digestive process that affect your absorption of calcium and water, increase the amount of stone forming substance in your urine. Pathophysiology. Renal lymphatic system drain renal site, then prevent accreditation aggregation of the principle of the kidney. Multiplication of the obliteration of the renal lymphatics. Salt precipitation concentration grid above the surrounding membrane, eventually causing urine percolation, then inevitable contact with the salt and other organic substance in the urine, and then develop into the large renal stones. Symptoms severe sharp pain in the side and back below the ribs. Pain that radiates to the lower abdomen and groin. Mm, Pain that comes in the waves and fluctuation in the intestine. Pain or burning sensation while urinating. Other signs and symptoms may including pink, red, or brown urine, cloudly of the foul something urine, persistent need the urinating more often that usually of the urinating in small amounts, nausea and vomiting, fever and chills if any infection is present. Diagnosis evaluation. Blood test for calcium, phosphate, uric acid and electrolytes. Blood urea, nitrogen, DUN and creatine to assess kidney functioning. Urinalysis to check for crystals, bacteria, blood and white cells. Examination of fast stone in the determination their type. The following test can rule out obstruction: abdominal X-ray, intravenous pulmonary IVP, retrograde polygram, ultrasound of the kidney, the preferred test, MRI scan of the abdomen and kidney, abdominal CT scan. मेडिकल मैनेजमेंट है द एलोप्रिन जाइलोप्रिम फॉर द यूरिक एंड acid stone, thiazine deuteric the prevent calcium stones from forming, sodium bicarbonate or sodium citrate to make the urine less acidic, phosphorus solution to prevent calcium stones from forming, ibuprofen Advil for pain. Acetaminophen, Tylenol for pain. Naproxen sodium for pain. सर्जिकल मैनेजमेंट हैं शॉक वेव लिथोट्रिप्सी SWL, यूरेट्रोस्कोपी URS एंड percussion नेफ्रोलिथोटोमी PNL. प्रिवेंशन है यू कैन substitute गिनर all lemon times soda and fruits juice for water to help you increase your fluid intake. If the stones are related to low citrate levels, citrate juice could help prevent the formation of stones. Eating oxalate-rich foods in moderate and reducing your intake of salt and animal protein can also lower your risk of kidney stone. Your doctor may prescribe medication to help prevent the formation of the calcium and uric acid stone. If you had a kidney stone or you are at risk for a kidney stone, speak with your doctor and discuss the best methods of prevention. Thank you.